Hello, I'm Dr. Robert Weaver. I'm the director and neuropsychologist at the Weaver Center in Wayland, Massachusetts. And I have really enjoyed doing these videos and getting the feedback from everybody about how helpful and other kinds of things that we could be doing to help educate other kids, adolescents, adults, and even senior adults what to do about attention, organization, depression, anxiety, apprehension, many of the things that come with our different learning styles. And as part of this, next couple of videos, people have asked, so can you give us some examples about what you do and why you feel it's different and so on and so forth? We never say it's unique, but we do say that we really work hard at having compensatory strategies based on one's strengths, that nobody's successful based on their problems, even though that's a way that most people approach this field, is knowing that it's important to get a diagnosis and so on and so forth, which it is. But in terms of developing strategies to compensate for areas of difficulties, we think that can only be done through one's individual strengths. And the more we know about, the more we identify those strengths, the more that we can use them to individually develop strategies that work almost immediately or very quickly, even though it takes practice, of course. So I thought I would mention a student that we just saw recently, very, very recently. He was a high school kid that was a junior, and this is the end of the year. It's June 1st. And about 2 weeks ago, he just started, not just started, he was complaining about school for a long time, a local high school, public high school, about how he wasn't doing well, how he felt that it wasn't satisfying, that he put in a lot of effort and he always got bad grades, and he was starting to be recognized by other people as being lazy and not working to potential, because he was articulate and bright, and people just made the assumption that if he wasn't doing well in school, it's because of an effort issue, which is often an interpretation made. But in his mind, he just stopped working, so it was a motivation issue. But for all year long, he was highly motivated and being really not doing very well, failing classes and exams and so forth. So he refused eventually he refused, like, as I said, about 2 weeks. He just said, I'm not finishing this year. I'm not going back. I'm not seeing a therapist. I'm not going to get help on this. I just had it for right now. I'm done. I'm burned. I'm hassled, right? And so his folks gave us a call, a referral from other people that we had seen here, which is our main source of referrals, are the folks that we've helped. And so they said, well, he's not going to come and see you, and so on and so forth. And I said, listen, just let him know that you really understand that and you don't blame him one bit. And if you were in his position with his experience, you'd probably be doing the same thing. In fact, he might have done this even earlier, to let him know that he's obviously persisted in a very, very difficult set of circumstances and challenges, and that they'd like to have him see Dr. Weaver or Buck Weaver. I always am comfortable with that. And of course, I advise them that if you didn't want to see somebody, first of all, that's the kind of kids we really like to see around here, those that are really having trouble and hate therapists. But so I said to the parents, listen, just see if you can work out something that he could earn by coming one time. And so they talked about different things and so on and so forth. And one of the main things that I suggest is, please don't do this for you. We're not talking about you getting therapy. In fact, we need therapy too, or some counseling or something. But really just do this for us. I mean, we understand why this would be so difficult and so hard. So he came and he visited with me the first time. He didn't want to have his parents there or anything. He just wanted the prize. So one of the first things we always do is a strengths inventory. And I always say, listen, we start, and this is true with the people that are here at the Weaver Center, the clinicians. I said, so, this is a little thing that we do, and I hope you find it interesting, and I hope you'll engage with me about it. And if it's not helpful, just let me know. So we start with, how many strengths do you think you have? And he I think you said 4 or 5 that you could think of right off. And I said, well, I'll bet you have maybe 30. So, of course, that's the first surprise that anybody says when they're down and out about, problems that they're having. That's a big focus of what they have. So I said, so, what are the 2 or 3 that, that you think you have? I said, well, I used to be pretty good at sports, although I don't care now. I'm not going to do any next year. But, I used to have friends, but they don't seem to be paying too much attention, to me. I do, and I am good at video games, which, of course, everybody hates that I'm good and do that all the time. And so, but that's it. So I said, so, what about the relationships that you had that were good? What would those people say to you? Well, they kind of thought I was funny or, I was engaging or interesting, but not anymore. So I would write those things down. And I said, what about any hobbies or activity? Well, I like fishing. I'm actually pretty good at fishing, and I've gone hunting. I'm not too great about that. I don't like that too much, but it certainly is nice to be in the woods. I like being in the woods and observing things. So we're writing these things down. And I said, so, are there any things in school that you are good at? And he said, not that I can think of now. So we move on for that. And we started to, after we got kind of a spontaneous and a little bit of a structured list of strengths, right? We have a list of attributes that we can go down and talk about, right? So are you honest? Are you loyal? Do you care about things? Do you care about people? Are you polite and nice? Are you, thoughtful? Are you passionate about anything that you want to do? Do you have an idea of what you want to do when you grow up? What do you think your talents and skills might be? So after about, I'd say, maybe 35 or 40 minutes, we have a list of about 35 things that he believes that he's good at. These aren't like just yes, 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 no. But it really helps us know our kids from their strengths, from their best sides. And it helps us help them reduce the things that they might be so focused on that's not going well to a broader sense of demystifying problems, to understanding that they really do have strengths and that this really is an area that they can use to be able to start dealing with the world. So the main part of this was this young lad became engaged. Because then he says, well, so how do you use this stuff? I mean, how do you use this stuff to help? And I give him an example about something that, like fishing. He likes fishing. Well, what are the things that you need to do to be better at homework or something? Well, there's a lot of similarities between fishing and homework in terms of having the materials, the tools, asking questions, getting good guidance, so on and so forth. The process is very similar. And it's a little more interesting if you're putting it in the context of something that you're already familiar with, okay? And so this was the beginning of a really good relationship, and he even started being agreeable to having testing, because I told him that we do neuropsychological and educational and social and emotional testing, really from a strength orientation, because we want to know more about your strengths and even your difficulties. Even those are important, they're not nearly as important as the things that you can do to apply to those. So this was something that, is pretty common around our place because we've been doing this for, 3 decades. And because of my own experiences, which I've talked in other tapes about my own dyslexia and attention deficit and organization issues, memory, and self-esteem for a really long time. These are things that we have developed and worked with for a long time on how to engage folks that, otherwise are very, very discouraged and very, very worrisome to their parents. In this case, they had somebody in the extended family that had had a lot of troubles and didn't turn out so well. So there's a lot of extra anxiety and stress and apprehension about his refusing to do these things. And they just were he was too, tremendously relieved, as was the school, because eventually next year we're going to be starting to, developing the strategy so that he never has another year like this. So again, thanks for all your questions. Don't hesitate to email me at rweaver@weavercenter.org. And oh, I still am rocking. I'm so sorry. I did do a whole tape about my rocking. That's just the nature of attention deficit. A little extra, motoric activity. But anyway, so give us a jingle and really like it. Thanks so much for your attention and your feedback. Wonderful. Bye.